Is my baby's umbilical cord infected? That's what I'm going to be answering today on today's video. This is Dr. Obedi of the Newborn Prep Academy, and I want to talk to you about your baby's umbilical cord. You know, the umbilical cord is one of those interesting parts of a baby that oftentimes moms and dads aren't quite sure what to make of it or how to handle it. It's almost like the baby's soft spot, and you're wondering, you know, how fragile is my baby's soft spot? You know, am I going to poke through it when I, touch the area? It just feels weird. And the umbilical cord is the umbilicus is something similar. You know, it's just one of those areas that, as it heals, can just look off. And so oftentimes parents are wondering, especially when the umbilical stump, which is a part of the umbilicus after the cord is caught that is still attached to the baby, when that dries off and falls off over the coming days or week or two after your baby is born, as it detaches from the umbilicus, that whole area can look very raw, and sometimes some bleeding can occur where there's a few spots of blood or just a very mucousy discharge in the area. And so can be very unnerving for a lot of parents, wondering if the area is infected, wondering if it hurts their baby. And so we're just going to cover a few things today. So number one, just remember that area does not have any nerve endings for pain, which means your baby actually does not feel any pain in the umbilical cord area, in the umbilical area. They can feel temperature and pressure. So if the area is soiled and you are wiping it, with just a clean wipe, or just water, which is usually what's advised, they may cry, but only because it's maybe cold or uncomfortable and not because it hurts. So number one is that area does not experience any pain. If I poked your baby's umbilical area with a needle, they're actually not going to feel any pain. They may feel uncomfortable because they can feel that I'm touching the area, but again, no pain. So that's number one to remember. Number two is that oftentimes it is not uncommon to have a little mucousy discharge in the area, or a little tinge of blood here and there as the umbilical stump detaches, and that is oftentimes normal. All right, we'll talk about when that is probably abnormal in a second. But just to realize that sometimes you can have a little discharge that is okay, all right, and sometimes that even smells a little off, but only just a little off, and that can be okay also. The third thing to remember is that sometimes when that umbilical stump detaches, so the little cord, that has shriveled off falls off, the area that's left can look like just a big glob of moist tissue in the area, and that also can happen. It's oftentimes what's called an umbilical granuloma, and that can be treated by a pediatrician with silver nitrate to dry it up, so it stops looking very moist, because that takes a long time to heal on its own. So those are a few common things that can happen with the umbilical cord as it pops off or falls off, I should say, that can be normal. Now, when do you need to worry about your baby's umbilical area being maybe possibly infected or just something wrong? Well, number one is if there's a really awful smell from the area. A little, smell here and there can be normal. Usually, if you just wipe with some with some water or a wet wipe, or even alcohol, that smell just tends to go away. But if it's infected, that's usually a really bad smell to the area. You're usually going to have some pussy discharge, not just a little mucus here and there, but just a really pussy discharge that can be concerning. You oftentimes will have some redness around the area, around the skin, redness on the skin surrounding the umbilical area. Maybe some swelling of the area. Your baby might have other more systemic symptoms like a fever or vomiting. Just signs that there's something really off or something really wrong. Should any of those signs be happening, or symptoms be happening, you really should take your baby to the emergency room or call their pediatrician right away to figure out what needs to be done or how they can be better evaluated. So those would be signs that there's something probably most likely wrong with the umbilical area. And of course, if you're not sure, you should call your pediatrician and discuss it with them. You are always better to err on the side of caution than just trying to pretend there's nothing going on or just, dispel with your worry. I really feel that oftentimes, a parent's worry needs to be explored carefully, because there are times where there's just an inner sense that there's something wrong with your baby, and you shouldn't ignore those feelings, okay? Well, I hope that helps when it comes to your baby's umbilical cord. And maybe a quick tip for caring for the umbilical cord will be just to keep it clean and keep it unsoiled. It is going to sometimes get soiled because, it's close to the diaper area. Poop or pee may get into on your baby's umbilical area. Just clean it with a wet wipe or just a wet washcloth. This water is usually enough to clean the area. Allow it to air dry, which sometimes will help with the process of healing. You can use some alcohol if you choose to. It's not necessarily helpful, and sometimes it's discouraged because it is thought that it gets the area too sterile, and there is some normal skin bacteria that is involved in allowing that area, the umbilical stump, to detach, and that may slow down that process. So I hope that was helpful with learning how to care for your baby's umbilical cord, and more importantly, spot when something may be wrong so you can seek help right away. Again, this is Dr. Biddy of the Newborn Prep Academy. Wherever you're watching this, there's going to be resources, links to resources that you can click to help you care for your newborn confidently. And I look forward to seeing you again on the next video.